and welcome. You're watching the Health Talk session by Yashoda Hospitals. Head and neck cancers is a complex disease that requires a comprehensive diagnostic evaluation and sophisticated treatment. Over the years, the incidence of head and neck cancers is increasing in India. To help make you informed decisions about the journey ahead, it is important to educate yourself about the common symptoms, diagnostic evaluation, and various treatment options about head and neck cancers. So let's discuss about head and neck cancers and more in our today's episode. I'm Dr. Lakshmi, and let's welcome Dr. Sashikanth Jonnalagadda, consultant ENT and head and neck surgeon from Yashoda Hospitals, High-Tech City. Welcome to the program, Doctor.
Thank you.
According to ICMR, head and neck cancer is the most common cancer, accounting for 30% of all cancers reported. So what exactly do we mean by this terminology, head and neck cancers, and how common is it?
As you rightly said, head and neck cancers combined together are the most common group of cancers in India. Head and neck cancers, by definition, include anything between the tip of your head, that is the scalp, to the clavicle bones, except for the brain, eye, and spinal cord. So it includes various subcategories of sites like oral cavity, voice box, which is larynx, then thyroid, then salivary glands like parotid, and then also includes all kind of neck tumors and skull-based tumors. As I said, India is one of the countries which has the highest prevalence of head and neck cancers. Nearly 1 in every 3 cancers in the body comes in the region of head and neck. It is quite common. In the Western countries like US, the incidence is around only 4 to 5%. But in India, as you said, it is around 30%. So it is a very important public health significance in India because of its high prevalence.
So, Doctor, every 1 in 3 cancers fall under this category. So, what are the most common causes for this cancer?
See, the most common cause in India, as we know, is tobacco chewing. So, that accounts to oral cavity cancers, which are predominant component of all head and neck cancers. So, oral tobacco, pan, gutka, even BD, smoking, reverse smoking is also found, which is found in Andhra, which is common cause of heart palate tumors. Other risk factors include alcohol. Even the new HPV virus is now known to cause a lot of oropharyngeal cancers. But again, the majority of the cancers are tobacco related in India.
According to a recent survey, these cancers are more common among the male population. So why do you think so?
Yeah, you're right. Head and neck cancers are more common in males, probably in the ratio of around 2:1. Because the risk factors are more in males. Males smoke more, they consume more alcohol, and even the habits of tobacco chewing and gutka are more common in males in India. That is why there is a high male preponderance in India for head neck cancers. However, there are certain parts of the head neck cancer subsites like thyroid, which are more common in females.
So talking about head and neck cancers, Doctor, which is a broad category, what are the most common symptoms that one should be aware of, and when do you think they should seek medical attention immediately?
Yeah, that's a good question. See, the common symptoms of head neck cancers are usual symptoms like ulcer, any ulcer in the head and neck region, tongue, oral cavity, buccal mucosa, that does not heal within 2 weeks. Is definitely needs to be investigated. That's one of the common presenting. Other presenting symptoms include a lump in the throat, a feeling of foreign body in the throat, change of voice, hoarseness of voice, swelling in the neck, difficulty swallowing, difficulty breathing. All these are common symptoms, but they need to be investigated if they last more than 2 weeks.
So are there any self-examinations that patients can do at home regularly to check upon themselves?
Unlike breast, there is difficult to do a self-examination. The only thing they can do is if they have an ulcer or a lump, they visit a doctor. Self-examination and self-diagnosis like breast cancer is rarely done in head and neck, as it is difficult to look into the natural orifices. But any lump or ulcer that does not heal immediately has to be followed up first at least with the primary care physician, and after 2 weeks of treatment with the routine treatment. If it doesn't get better, then definitely needs to see a head and neck surgeon.
So, doctor, when the patient approaches you with the symptoms we've discussed, so how do you go about treating this patient?
Yeah, this is a common question asked by a lot of patients, whether they already have a diagnosis of cancer or they are presenting with symptoms. I tell patients there are three unique steps in the cancer management. First is the diagnosis, that is establishing that the patient has cancer, which is done by a couple of tests, which is usually begins with a biopsy, which is taking a small piece of tissue and sending it for pathology examination. And if required, an immunohistochemistry can be done over that to determine the subtype of cancer. That's the first step to diagnose what cancer is it. First of all, is it a cancer and what type of cancer? Then comes the step 2 part, which is the staging part. Staging part is now once we know that there is a cancer, we will have to find out where it has spread. That is called the staging pattern. To do the staging, we get a lot of investigations, which includes, not in every case, but in most cases includes either an ultrasound, CT with neck with contrast, MRI, or PET scan. Not all investigations are done in every case. It is a combination of investigations based on the staging. But once we get all these investigations, we get a radiological picture of where the tumor has spread. And once we get that, when we do what is called as clinical staging, that is an NCCN guidelines determines what stage this patient fits into. And once that is determined, then we follow what NCCN guidelines to determine the third step, which is the appropriate treatment for the patient.
So, could you explain the various treatment modalities available for treating head and neck cancers, doctor?
Yeah, there are three modalities of treatment. Like in any cancer, head neck cancer, there are three modalities of treatment, which is surgery, then radiation, and chemotherapy. So the modality of treatment chosen depends on the stage of the tumors. Usually, for most of the subsets of head and neck cancers, for early stage tumors like T1 and T2, the primary modality of treatment is surgery. For late stage tumors, that is T3 and T4 tumors, that is bigger tumors and tumors that have spread to lymph nodes, the modality of treatment usually is surgery followed by radiation or surgery followed by chemoradiation. There are some exceptions to this rule, like for example nasopharynx, where we primarily go with chemoradiation or radiation first. And thyroid. For thyroid, the only option is surgery. Surgery is the only management, followed by radioactive iodine. Not radiation, but radioactive iodine. So it depends on the subsite of the origin and the stage of the tumor, which will determine the final treatment for the patient.
So, discussing about the various treatment modalities, doctor, what are some of the recent advancements made in this area especially?
So, like every field in medicine, head neck medicine is a rapidly progressing field. There comes new technology, new causes of the diseases. Like I mentioned, HPV is a growing cause of disease of oropharynx in the West, and I think in India also soon you will find a lot of HPV positive cancers. So there are a lot of emerging trends. In terms of technology, we now have robotic surgery to do the head and neck. For example, previously in areas like we couldn't reach, like tongue base, where you had to split the mandible and open the big open surgery, do a big open surgery. Now we can do with a robotic, we can reach the backside of the tongue and the larynx and do a minimally invasive surgery. Then even in thyroid surgeries, there are new technologies like nerve monitor. The most important complication of a thyroid surgery is loss of voice because of the injury to the voice nerve. So now we use a new technology here, which is called nerve monitoring, wherein we monitor continuously the feedback from the nerve, and it helps us save the nerves in majority of the patients. There are other technologies like minimally invasive radio-guided parathyroidectomy, even the harmonic devices, and even endoscopic skull-based surgeries. So there are a lot of technical advancements in the field of head neck surgery, which finally aim to decrease the morbidity of the patient and increase the outcomes of the surgery.
In India, most of the cancers are detected at a later stage, hence early detection is of paramount importance. So what are some of the screening methods that you implement in your clinical practice, doctor, or that you would recommend?
As per NCCN and American Cancer Society guidelines, there are no screening methods per se for a lay public to undergo once in a year or so for the screening of head neck cancers. Only they have to be vigilant of the symptoms, like I mentioned, ulcers that are not healing, swelling in the body that doesn't go away, hoarseness of voice that lasts more than 2 weeks, that need to be kept in mind, and a doctor has to be consulted. But there are no screening programs for head and neck cancer per se.
So, what are some of the most common misconceptions or myths surrounding head and neck cancers, and how do you address them?
Excellent question. So there are a lot of misconceptions in head neck cancers in India. One of the common misconceptions that I encounter with my patients is whenever we tell the patient surgery, they tell surgery. Whenever I mention the word surgery, they're like dumbfounded and they look very astonishing and scared. And they think that surgery for head and neck cancer is a procedure that is extremely morbid, where you cut open the face, where you cut open the neck and remove the tumor. Well, that was true in the past, but with modern reconstructive surgery, not only is the head and neck surgery ablative, wherein we remove the tumors, we also restore the function and form of the removed organ. For example, if I remove a voice box, we put a voice prosthesis so that the patient can talk normally. If we remove the tongue, we replace the tongue with a free flap or other flaps where the patient can eat and talk normally. So the goal of a modern surgery is not just to provide the cure for the cancer, head and neck cancers, but also to reconstruct both the form and function of the removed organ. So that is the common misconception that I listen from patients. They are very afraid of surgery because they would have seen some old patients who had disfiguring surgery, which may be true in the past, but with modern reconstructive surgeries and minimally invasive surgeries, that is no more true.
So, before ending this episode, doctor, are there any lifestyle modifications that patients can adopt to prevent head and neck cancers especially?
Absolutely. So one of the lifestyle modifications I would tell all my patients is, like any doctor would tell you, quit smoking, quit tobacco, reduce your consumption of alcohol, especially the dangerous forms of tobacco are the oral tobacco, gutka, chaini, pans. If consumed on a regular basis, form a very high risk factor for head and neck cancer. So modifying these factors definitely will reduce the incidence of head and neck cancers in our country. I think those lifestyle modifications, patient ought to put an effort to cut down the consumption of tobacco.
So thank you, doctor. It was wonderful having you here on our program today.
Thank you. It was my pleasure.
So this brings us to the end of this episode. Hope this episode was informative on the topic head and neck cancers, and don't forget to join us for the next week as well. Until then, take care and stay healthy. Thank you.